Well, today marks World Obesity Day, and research shows obesity has nearly tripled worldwide since 1975, with an estimated 38 million children under the age of 5 being overweight or obese in 2022 alone. The World Health Organization is calling for a cohesive cross-sector response to this condition. Profmed Clinical Executive Justine Lacy joins us now for more. Those are concerning numbers there, Justine. Welcome to the program. Thank you very much for your time. We know in South Africa, according to some research, a third of men and two-thirds of women are overweight or clinically obese. And just very crudely put, what's making us fat and sick?
Well, there are a number of conditions, Iman. Good afternoon, and thank you for having me. Certainly, dietary habits and lack of physical exercise are up there amongst some of the more common causes of obesity. However, there is a myth or a misconception out there that these are the only factors that cause obesity. And I think it's important for people to realize that genetics, medications, and even some medical disorders can also cause obesity.
And I think those distinctions are important, Justine, because we know not only in South Africa, but anywhere you go around the world, there's so much stigma involved, with people who are overweight or considered to be obese. So just talk to us and give us some more information about things, that we can do, not only to deal with the stigma, but also to find out why it's happening.
So I think it's important to state that there's a high prevalence of obesity, and there's absolutely no doubt that we're in the middle of a global obesity pandemic. And of course, this has significant public health implications and challenges, and it's important to understand that misconceptions and misinformation has resulted in a toxic concept of obesity. It would be certainly important for us to understand that is why there is such a stigma attached to obesity. So it's actually society's responsibility to unpack this, and that's why we have World Obesity Day, which is marked every year on the 4th of March, so that we can start changing these perceptions that the public have in terms of obesity, and also heighten awareness in terms of the dangers of remaining obese and what the implications are should that go unchecked.
Millions of children around the world afflicted by this. Talk to us about some of the health risks, and then we'll talk to some of the interventions. And I think what's important to mention is it's not just, somebody deciding that something's wrong and now they need a whole bunch of willpower and the problem is overcome. We'll come back to the really serious approach that we need in dealing with it, particularly, as you say, it's a global pandemic. So what are some of the immediate health risks associated with being overweight and clinically obese?
So in the short term, there's no doubt that we know that obesity impairs your health. And that's not just on a physical level, but also a mental level. So in the short term, what one would see with somebody who's struggling with their weight, especially we're talking grossly obese, that is having a body mass index of more than 30, is shortness of breath, perspiration, and generally a real difficulty in moving about. And this is obviously affects one's daily activities. Then in the longer run, with the short-term implications having gone on for some time unchecked, this is obviously a precursor to your more chronic conditions. There are a multitude of conditions that one can develop as a result of obesity. To name but a few would be diabetes, osteoarthritis of the joints, heart conditions such as high blood pressure, high cholesterol, heart failure, and even some forms of cancer. And the list goes on and on.
Yeah, very scary picture. So let's talk about interventions then. the first part is understanding what's going on, and you talked at the beginning about some of the genetic disorders or, the genetic markers that predispose people to being overweight and obese. So go and get tested and find out exactly what that profile is all about.
Yeah.
And then there would be lifestyle interventions. So let's talk a little bit more about how we deal with this in a way that it doesn't continue to become a public health burden.
So, Iman, there are things that one can do as an individual in your own time. And obviously, if the condition is severe, one would then obviously need the intervention of a multidisciplinary team, because the literature certainly shows that multi-component intervention is the most effective way of sorting out obesity, because it's such a complex and multi-dimensional condition. It certainly needs the intervention of a number of healthcare professionals in order to ensure that there are effective outcomes. But on an individual level, one can certainly look at diet, and we know that energy-dense foods as well as processed foods is something that people are consuming in huge amounts. And those are all high in fat, sugar, and salt. So we need to move away from that and look more towards portion control as well as more naturally grown food in our diets. Physical exercise or lack thereof, which we refer to as a sedentary lifestyle, is another thing to look at, and that would obviously be an increase in. One would need to look at an increase in one's physical activity, and that if you're having children that are struggling with their weight, it's nice to look at that as a family component. So parents introducing a good example of exercising as a family component. Then, of course, reducing screen time and things like that. Obviously, from a sort of a more medical intervention perspective, one would probably be referred to a dietitian as well as a physiotherapist, to name but a few, by your medical practitioner should things be severe.
And these are important interventions that you're talking about, Justine. Unfortunately, in some cases, very much restricted to the middle class, who might have the ability to access therapists, might have the ability to access, certain interventions, particularly when there might be surgical interventions that are needed. And I think listening to you as well, it's very, very important that, because a lot of people, conventional wisdom dictates, yes, eat less, exercise, live, a life that has a bit more movement in it, and things should get better avoid high foods in high fat, sugar, and salt. So people know all of this. What's the missing link in why we aren't doing enough, and particularly what's available for those who don't have access to your medical aids and your psychosocial support?
So I think what's missing is the myths and the misconceptions that diet and physical exercise will sort obesity out. And as mentioned before, it's people getting that misinformation that it's not just about those things, that sometimes the causes require medical attention. So it's about unpacking that, and because people seem to not understand what obesity is about and just how complex that disease can be, because there are a lot of mental health components to that too. And even something as simple as disrupted sleep patterns can contribute towards obesity. In terms of people seeking help who don't have the financial means to do so, there would always be public facilities that one could go to, and certainly one can find resources in a number of areas. World Obesity Day would certainly run a number of campaigns across or globally to create this awareness. So one would need to just look out for things like that. But I think schools also play a huge part in educating the underprivileged in terms of healthy diets and exercise.
Justine Lacy, thank you very much for sharing the message on World Obesity today. World Obesity Day, and some of the interventions that we need to take care of in order to continue to prevent and mitigate public health crisis burden in the health sector for diseases like, diabetes, hypertension, and heart-related diseases. So appreciate your sharing your perspective this morning. That was Justine Lacy, who is a clinical expert at Profmed.